Good evening, everyone, and welcome once again to our special edition, the Wellness Corner. Today, we're talking about important matter. We're talking about chronic diseases, diabetes, high blood pressure, and we're also talking about obesity. We know how many people are being affected nowadays on that, and we have special people to come on board to try to clear out the misconception about those chronic diseases. And the most important thing, you have been wondering why once you get to a doctor, a medical doctor, the first thing is for them to check your blood pressure or your sugar level, because this has a very great impact on your health. And tonight we're going to clear all the myth around the diseases and educate you how to take care of your health so that you don't submit yourself to the complication of this disease. And joining me tonight are specialists in the field. We have medical doctors that have been in the field for so long. They have dived into the disease. They have embraced the in and out, and they are ready to share with us all the information surrounding those chronic disease, and also to give us way to remedy it and also how to prevent it. Our first guest speaker is Dr. Mia. Dr. Mia, the most important thing is that they are experienced. They have been in the field for so long. Dr. Mia has been a medical doctor for more than 20 years, a full medical doctor. She's a mother, she's married, mother of 2 boys, and she has served diligently, whether in a private and public sector. So it's an honor for me to welcome you tonight. Dr. Mia, welcome. Thank you for honoring us with your presence tonight. And with you, we're going to start with one of the most important one is diabetes. We're just wondering, what is it? People keep on saying diabetes. And why is it that people really suffer from it? Do they really understand? We want you to break it out for us and simply so that even a layman can understand. How does it operate? How does it affect the body? What is it exactly?
Thank you very much. And I'm happy to be here tonight. And firstly, I would like to thank God for this opportunity, to thank Josiane and everyone who's here tonight. I was being asked to talk about diabetes mellitus, and it's a very big topic. And I just try to put it simple so that everyone can understand in a few words. And I try to make my words simple so that everyone can take it also easily. I'm going to speak about the definition as my first point, the definition of the diabetes mellitus, the causes of diabetes mellitus, the symptom, the diagnosis, type of diabetes, management or treatment, if any. I'm going to speak also about the prevention and the complication of the diabetes mellitus. As we know, the diabetes mellitus is a chronic disease, meaning that the disease that is there in the body for a long time. But in this disease, the body does not control the amount of the glucose. The glucose is the sugar, a type of sugar in the body. And in the kidney, you will see that there is also amount of the glucose. If I want to make it again simple, I can say again that It's a chronic disease with an elevated blood sugar. And this leads over a period of time to serious damages to the heart, the blood vessel, eyes, kidney, and nerves. So to speak about the diabetes is not when I check once my sugar level, then I say only one time is high, then I can say I'm diabetic. No, it must be a period of long time. So, and the blood sugar must be elevated for a long period. We do have cause of diabetes. The main cause of diabetes is the production of the insulin. And insulin is the hormone that is produced in the body and that is controlling or that is regulating the level of the blood in the body. So in the case of diabetes, the insulin is either not produced is not enough in the body, or is there, but is not really, or the body is not really affected by the quantity of the insulin that is there in the body. So if I can say it again nicely, is that the pancreas, that is one of the organs in the body, it doesn't produce enough insulin, or the body himself cannot effectively use the insulin that is produced. So we do have what we call a risk factor or chances for someone to develop the diabetes. So I'm going to name them. We do have a weight that is either overweight or obesity. And in the obesity, we do have also the fat distribution. So if the storing of the fat is more in the abdomen than in the other parts of the body, you can have a chance of developing diabetes in your life. The other factor is the inactivity. Someone who's not really in activity, so who's more, I can say it like that, more sitting than doing some activity, can be at risk of developing diabetes. If you do have a family history, you can also be at risk of developing diabetes. And there are studies that was being done that is showing also that some race have more chance of developing diabetes than others, like black are more having a risk of developing than other race. So the level of the cholesterol in the body, if the cholesterol is high, you can be at risk of developing diabetes. The age and the state that we call the pre-diabetes, I will have to explain it after. So saying that, we are going to speak about the type of diabetes. We do have two main types of diabetes that we call type 1 and type 2. In type 1, the body makes little or not at all the insulin. Remember, we say the insulin is the hormone that regulates the amount of the sugar in the blood. So in type 1, there is not insulin or just a little insulin. And the type 1 is also called a juvenile diabetes or childhood onset, because usually you get that type to the young people. And that's why it's even called by juvenile diabetes. Then we do have in this type of diabetes, that is the type 1, because the body does not produce enough or not at all the insulin, the patient will need insulin as treatment. And in the type 2 diabetes, with that type 2, it's called non-insulin dependent. So doesn't depend on the quantity of the insulin that is produced. And usually you get it also, you see it with adult, or it starts when you become adult. In the type 2 diabetes, it can be also a result for the fact that the body produces insulin, but is unable to use it. You can still have insulin in the body, but the body is unable to use that insulin. And as I said, in this type, it was seen only in adults, but it is now also occurring in children. You can still see also this type of diabetes in children. There is a special type of diabetes that is called gestational diabetes. This one is seen only in pregnant women. So you can see a pregnant woman during the pregnancy at a certain stage, the blood sugar that goes up during the pregnancy. And when the pregnant women will deliver, then the sugar will go back to the normal value. So it is called gestational diabetes. And those patients with gestational diabetes, some of them, after even delivery, they can still have this elevated sugar in the blood. So, and at this case, they will not be called again as gestational diabetes, they'll become diabetes in their life. After the type of diabetes, we are going to share now the symptom of diabetes. In most of the case, people are unaware of the symptom. You don't get anything at all. You just go to the clinic, maybe for the checkup. They start by doing some blood tests, then they find that you have diabetes. But most of the time, there are some symptoms that you can have. And you will see that someone is urinating more than usual, or excessive excretion of urine. So time to time, you just feel like you have to go to the toilet. Apart from that, you can be someone who's just thirst. You have thirst all the time. You just feel like you have to drink water. You can drink water now, or you can eat now, but you still feel like you need to drink more water, despite the quantity of the meal or the drink or a lot of water that you took. You feel like you have again to drink water or to eat again. So this can be also the sign of diabetes. You can also get a weight loss, sudden weight loss. And you can have change of your vision, blurred vision. You can have tiredness or fatigue, and you can have some other symptom that is not really related directly to diabetes. That can be the cramps on the body, or a man with erectile dysfunction. Some of them, I'm not saying that all of them, some of them it can be due because of the elevated blood sugar, or you can have what we call a recurrent yeast infection. You can feel also maybe the tingling in your hand, the feet. You can be someone who's having a wound that doesn't heal, or it's healing very slowly. Those are the people that when they go to the clinic, hospital to check the sugar, you can see that their sugar is elevated. I'm coming back again to say, I'm not saying that if you have a yeast infection all the time, meaning that you have a, a, a sugar problem. No, we need to test so that we can make sure that is it sugar or something else. But usually those people who are having diabetes, they can have this urinating that is more than usual. They can be thirsty all the time, or hungry all the time, just feel like they have to eat or what. They can lose their weight. They can have changes in their vision, tiredness, and others that I just named.
Wow, thank you very much. Thank you for really giving us those symptoms, because once you know, you are even able to seek medical attention when you start seeing those signs. And thank you for that clarification. And if someone is listening to us and you having those signs manifesting, please seek medical attention. Dr. Mia, the other thing I wanted to ask is always say that once you are diabetes, it leads to other diseases. It is a foundation to many other complicated diseases. They even say there are complications that come with diabetes, that you don't die of diabetes, but complication. Can you list some of these complications or some diseases that are caused by diabetes?
Okay. Usually, if you don't treat nicely diabetes, you can go to the complication that can be the risk of heart attack or stroke. You can have the damage of your nerves. You can go to blindness. You can have also the kidney failure due to diabetes that is poorly controlled. And you can have some several infection, because the diabetes can reduce your immunity system. Those are the main complications that you can get. I usually tell my patients that the diabetes, if you don't treat it nicely, can give you the consequences from the head to the toe. So as I was saying, the head, you can have a stroke. On the chest here, it can be a heart attack. On the abdomen, you can have kidney problem. The legs, you can have the nerves problem that we call the neuropathy. And I forgot to say that in the eyes also, you can get this blindness. You can have visual problem due to diabetes that is not controlled.
Wow. No, that's frightening. Eh? That's really frightening. So it's like all the part of your body, like you said, from head to tail to toe
Yes,
can be affected. And
from
it's
the head
serious,
to
it's a
the
serious
toe, yeah.
matter. Yes. And how can we treat it? Because there are people out there that has really suffering from it. I have a brother who died on Monday because of complication. Right now, we have a body at the mortuary due to diabetic. It was said that he wasn't taking care of himself. He wasn't applying the insulin and so on. And yes, and how can once you have been diagnosed with diabetes, How can you remedy it, or can you treat it? Can it be treated?
Okay, in summary, diabetes, the treatment for diabetic, or in summary, we do have a treatment for diabetes. Although we cannot reverse it, but we can treat it so that you can have a normal lifestyle or normal life. So we do have what we call the diet, exercise, and the treatment. Sorry, the medical treatment. And I'm speaking about the tablet or the injection, depending of what type of diabetes you have. If you have what we call insulin dependent diabetes, you will need those injections that we are saying. But if you don't have that one, then you can get the tablets. And there are a lot of tablets now in the market for diabetes. But the treatment is not only about the medication that you take. The diet and exercise is having a big part or a big role in the management of the diabetes. I believe we have a dietitian here. He's going to give us more detail about the diet. There are food that the diabetic patient is not supposed to take, just to try to control his sugar level. And the exercise, as I say, remember we say inactivity is a risk factor for getting diabetes. But then in the management, we recommend that someone be active at least 30 minutes, 3 times a week can help. But if you can do more, you are welcome to do it. So the treatment for the diabetic is having 3 parts. The lifestyle with modification, that is the diet, and the exercise inside. And we do have other insulin injection or the tablet, depending on the type of the diabetes that you have.
Wow. No, thank you very much, Dr. Mia, for that, for those clarification, for those important information. And there is hope. There is hope for those who have been diagnosed diabetes. You can still just embrace that good lifestyle, exercise, and mostly seek medical attention. And we are having on this platform Dr. Gil Wanner. She's a wellness coach. I know Dr. Mia was spoke about dietitian or fitness, and there were not coming on regarding obesity, weight that are related to the condition. So we are honored to have Gil here with us. She's a wellness coach for more than 27 years. So she has been dealing with lifestyle change, and she also have a background in biochemistry and genetics. So when it comes to knowing your body, she's an expert there, and she's passionate about wellness and so on. So Gil, we wanted you to really come in and try to give us few information about how to remedy this or how to go about it. Welcome, Gil.
Good evening. Thank you so much, Josiane. Thank you so much for inviting me to speak here tonight with you. And thank you, Dr. Mia, for what you were telling us about diabetes over there. All I can say is prevention is better than cure. My goodness, listening to all the things that can be affected with diabetes, it's just surely much better to look after ourselves. And with that, I'd like to start with one of my favorite sayings is, we only have one body. We were given one body. And it's to look after that one body, because when it gives in, where are we going? You know, and you know, the funny thing is, though, I'm going to talk about obesity, but but largely part of it is lifestyle. Eating unhealthy, going to fast food, eating takeouts has become so normalized that when we eat healthy, we're going on a diet. Why is it not the other way around? Why are we not eating healthy as a matter of course? That would just make it so much easier to look after the one body we have. So what I will be discussing here is obesity. And like Josiane says, I have been helping my clients over the last 27 years just to really adjust their lifestyle habits. Because, you know, what makes up our decisions on what we eat is largely our habits. Habits play a big role in it. Our culture, we generally eat what our culture dictates. And taste, obviously, we will always go for taste. And convenience. So those four things will drive what we eat. It will drive our lifestyle. And just to obesity, it is a non-communicable disease. We don't catch it from the person next door. We do it to ourselves. And it's really quite sad. Going back to what I said previously, we only have one body. It behooves us to, I mean, we were given this miraculous body. It behooves us to look after it. So again, what is obesity? It's an abnormal or excessive fat accumulation that really presents health risks. So what we typically look at is the body mass index. So it's a BMI. And what that is it's a ratio of your height to weight in simple terms. Ratio of your height to weight. So obviously your height stays the same. As we age, we lose a little bit of height, of course, but let's just say the height stays the same. So as your weight comes down, the ratio will become into the healthy range. So we're talking about normal men and women in the street, not bodybuilders. They will have a different body mass index because of their muscle bulk. But let's talk about the normal man and woman in the street. Generally, your body mass index should be between 18 and 25. If your body mass index is over 25, you're overweight. If it's over 30, you're obese. So that is just the general explanation of how we would know whether we're overweight or whether we're obese. And sorry,
yes, I want to find out, is there a difference between being obese and being overweight? I just need more clarification on that.
So being obese would be a BMI over 30. So typically you'd be about 15 or 20 kilograms over your ideal weight. So there is a chart that you work out the BMI, and it's your height to weight. And we on the chart where your height and weight meet up on this chart, it is your BMI. And so if your BMI is,
and how do you determine that BMI? How is it determined?
Okay, Josiane, it's on a chart. It is worked out on it's a ratio that I can share with you later. We can put it onto the Facebook. We can put it in there. But it is a ratio, but this chart is very easy, that you just find your height, find your weight, run your finger along until the columns meet up, and that is your BMI. As well, there are many BMI calculators online, and you put in your height, you put in your weight, and it will work out what your BMI is. So it's just really a rough indicator, or quite a clear indicator whether you're overweight or whether you're obese. Obese is 15 to 20 kilograms over your ideal weight. And on this chart as well, it will show you for your height, what is your ideal weight as well. So when I personally do wellness assessments for my clients, I do give them what their normal weight range would be for a healthy, for their height. Does that answer your question, Josiane?
Yes, no, that's quite clear. So that's inform us that it's important to know what is your ideal weight so that you fight for it, because and knowing that you're not in that line, it is already a red light. So it's a call for all of us to just try to know what should be our ideal weight. No, thank you for that. Thank you for that.
Okay, so this symptoms of being obese would be, or we're talking about obesity here, is a difficulty in sleeping. So typically somebody who's obese would find it very difficult to lie flat on their back and breathe normally. They would have sleep apnea, so they would have difficulty in breathing. They would have back and joint pain because there's a lot of weight on the joints, especially the knees. They'll have excessive sweating, intolerance to heat, infections in the skin folds. They will have fatigue. If you can imagine, the normal body frame is carrying excessive weight. So obviously fatigue is a common symptom. Depression, a feeling of shortness of breath, and skin problems. So these are some of the symptoms that would go with obesity. But again, just going to the fact that we actually do this to ourselves. And really, we shouldn't blame ourselves either, because the food industry knows that our brain goes for sugar, salt, and fat. And so sugar, salt, and fat is added to our foods to make us go back for more. And billions of rands and dollars are spent on fast food, and more especially, I'm going to talk about crisps, chips. Billions of dollars are spent on that crunch, the certain taste on our tongue. We are just hapless victims, actually, because the food industry knows if they put in the right amount of salt, the right amount of fat, and the right amount of sugar, salt, and fat, we are like hapless victims. And we really have to stay cognizant of what's going on in our lifestyles and the foods that we're choosing to eat. So my advice is that if it's not in the house, typically you won't get in your car or walk to the shops to go and buy it. So the idea is not to have it in the house. Don't buy it. Don't have the chips, the biscuits, the unhealthy foods in your house. That will go a long way to leading you to a healthy lifestyle. But what causes obesity? Oftentimes it's our eating patterns. You know, if you're sitting watching TV or you're sitting at your desk, you're not cognizant of how much you're eating. And you will only stop eating that packet of chips when it's finished, because you are distracted by the television. You continue to eat until the packet's finished. Fast food, going back to the sugar, salt, and fat, it's delicious, it's tasty, but we have to be cognizant of that and not go for those foods. Yes, you can do it now and then, but not every day. Physical activities. A lot of times people don't have the time or the inclination to want to be physically active. As Dr. Mia was saying, it goes a long way to alleviating the symptoms of, or even becoming diabetic. Your sleep routines. Research is now showing that if you have a disrupted sleep pattern, it will contribute to weight gain as well. So how do we prevent obesity? One of the main things is a lot of times we beat ourselves up and we take the blame, and we eat, emotional eating. And one of the main things to overcome obesity is to just recognize what it is, put away the big stick, put away the blame, decide that you're going to make a change, and grab an accountability partner. Take a coach who will be able to help you and guide you and show you which of the habits that are tripping you up. You know, the body needs certain things. It needs fats, carbohydrates, protein, less saturated fats, more omega-3s, fiber, at least 25 grams of fiber, hydration, omega-3s, of course, exercise. So there's certain things that we need. But, you know, if you are tending to be on the obese side, you don't oftentimes have the motivation to make the changes. It's just so much easier to just go for that next scone or cake or whatever. So I'm saying grab an accountability partner, you know, get a coach who'll be able to guide you and show you which are the things that are tripping you up. What are the triggers? What is in your environment that's triggering the things that lead you to eating more? And of course, the big one, which is the most simplest to sort out, is how much water we're drinking. Oftentimes, my clients will say that they drink a lot of water. and I will ask them how much water, and it'll be 1 or 2 glasses. And we like to work on a formula of, for every 30 kilograms of body weight, you should be having 1 liter of water. So that's a kind of rough formula that we work on. And it's not a difficult thing to do, but it is a difficult thing to do. So what I'm trying to say here is obesity is on the increase because of our lifestyles, because of the availability of high calorie foods like fast foods. So it is on the increase, although we have gyms just about on every corner. You just only need to go into YouTube and there's a plethora of videos there to show you how to manage your weight, yet obesity is on the increase. And I think a lot of that goes to that we feel alone, we feel and we go to emotional eating. So again, what I'm saying is reach out, your colleagues at work, reach out to friends and just realize that it is preventable. It's not something that we get from somebody else. We do it to ourselves. Decide you have one body, and 70% of how we age is in our hands. Only 30% is down to our genetics. So, if you are tending towards obesity, it's never too late to just decide that you're going to make the lifestyle changes. Reach out to a coach. I myself, I love to coach people just to lead them, what I say, from not knowing to knowing, how they can live a healthy lifestyle. And it's a few simple things. It's not major. It's not earth shattering. It's a few simple things. But when you've got a coach guiding you, showing you those little things that have been tripping you up all these years, it's that much easier to get under your belt. Back to you, Josiane.
Wow. That's amazing. Really. One thing that we only have one body is up to us. It's up to us what you want to do with that body. And even knowing the fact that you highlight that the industry itself, the consumer industry, the food industry is already prompting us to really consume those food that will harm us. So it's good that we are aware of these things so that we choose wisely. And that even come to the way we are nourishing our family, starting with the kid. What we have noticed that we're getting them used to those food that are not healthy. The chips, I know in creches, the parent will always put a packet of chips every day in the back of a child, not knowing that that is actually the poison that is going to really play negatively on the health of these children. So I also like the fact that you said that we need to just gather what is important for our body, not just getting food here and there. No, thank you very much. And the element of water, that was also very key. I know sometimes we don't really pay attention to water, but not knowing that that is what is going to even fuel that is going to help us in being healthy and help in the mechanism in our body to function properly. So that is another call. Drink a lot of water. It's very important. And obesity prompts you to chronic diseases. So no, thank you very much, Gil, for those great information that were shared here. Sometimes we need to just listen to those things. The more we listen, the more we take action. Because when you don't know, everything seems normal. But when you know that what you're doing is wrong, it's already half battle fought. So thank you very much. Without further ado, we're also going to invite Dr. Annie, Reverend Annie. She's going to look at the element, another key element, that is high blood pressure. Welcome, Dr. Annie. Dr. Annie is a medical doctor. She has been on practice for more than 20 years also. She's married for more than 20 years, only 20 figures. She's also a pastor. She's very queen when it comes to empowering women. She has an organization for women. I know whenever you call Dr. Annie to just come and try to educate or empower, she will just jump in. And thank you for that heart, and thank you for the service. And the same time you're serving in the hospital, and you're serving also at the church. Dr. Anyiri, just looking at the issue of high blood pressure, that is also one key element when we talk about chronic diseases. And it's most of the time is being called the silent killer. What is it? What is high blood pressure? You know, they use this big term sometimes, and that mama that is suffering there in the rural area won't understand. She go to the hospital, they say, mama is bad now, you have high blood pressure. When do you say someone have high blood pressure? How does it work? I want to understand that from the way the body operates. Please break it down for us.
Good evening to everyone. Thank you again for allowing me to come and share this panel. You know, I always appreciate the effort you are doing for our community. So regarding the time, I will try to go fast and break it as in a simple word that everyone can understand. So starting, what is blood pressure? I might say a car without fuel cannot drive. Are you getting me?
Yes, yes.
Can you hear me?
Yeah. Yeah, you already bring it.
A car without fuel cannot. A car without fuel cannot drive, cannot move. For a car to move, no matter how beautiful is the car, how luxury is the car, how skoro is the car, it needs fuel. If there's no fuel, even though you fix it, nothing will work. I'm talking about the car we are using, not the one is still experimental using solar or electricity, is still in the experimental stage. I'm talking about the car we use. We need fuel. The same way a car without fuel cannot move, the same way a body without blood cannot live. If your body does not have blood, it will not live. So it means all the body that you are seeing going around, walking, there is blood circulating in it. And for the blood to circulate inside your body, you need two major organs. The first one is what we call the heart, and the second one is a group of organs which is called vessels, if I have to call it organs. So the heart here, it plays the roles of a pump, and the vessels are playing the role of the pipe. And between the vessels, we do have the arteries, the category of vessels, the category of pipe that we call arteries, and the other category is called veins. So the heart, as I say, playing the role of a pump, it contracted and releasing. When it contracted, is ejecting the blood to go around the body. And for that blood to go around the body, it's passing through the pipe, which is called artery. When it's passing through the pipe called artery, it's going to supply the blood in the brain, it's supplying the blood in the kidney, the lungs, everywhere, the eyes, every organ in the body needs that blood. So it's passing through the artery. And when it's passing through the artery, supplying everywhere, from those everywhere, it has to come back to the heart using the veins. It's coming back to the heart through the veins. So here we are talking about that pump called heart, sending the blood to the pipe called vessels. So the fact that it's going through the pipe called vessels, it needs a pressure. It's like a tap when you open for water to go through the pipe, it needs pressure. So at least we understand the two in blood and pressure. So what is blood pressure? Blood pressure is simply the measure of the pressure which is used in the pushing system to send blood all over the body. I think you are getting me. It's simply blood pressure is the measurement of the pressure system that the heart uses to push the blood through the pipe so that it goes and supply all the other organs. Is that one we call blood pressure. So how we measure that blood pressure is obviously we use the machine which is called
the blood pressure machine. I don't want to go through many explanations there. The blood pressure machine, and it gave us two figure numbers. The first one, it's called systolic. You know, as I say, the heart is contracting to send the blood, and when it push the blood to the pipe, it's a systolic pressure. When the blood relax, it rests, we have the diastolic pressure, which gives us two kinds of pressure. The systolic one pushing the blood, and the diastolic one allowing the blood to rest. And conventionally, we say that it was found that when the blood pressure is between 90 and 60 to 120 and 80, we say you have a normal blood pressure. It means the blood circulating in the normal way in your body. Especially the number that we take is the 120 over 80. 120 over 80, we are all satisfied that your body is functioning normal. Your heart can do the normal pump on this serving blood all over the body. Once now you start going up with your measurement of blood pressure, you reach 140 over 90, then now it starts to be a problem. It starts to be a problem. We think we start talking about high blood pressure when you reach 140 over 90. And when you go beyond, you will say we will be talking about moderate blood pressure, mild blood pressure, severe blood pressure, emergency blood pressure. I don't want to give you more numbers for you not to be confused. But you can understand here that whenever you go to the hospital, doctor should make sure. That's why you see the first thing the nurse they check is your blood pressure. They have to make sure that your blood is going around your body nicely without any problem. Why we have to make sure that it's going around your body without any problem? Because usually, sometime when the blood pressure is high, you may not have any symptom. It might be like you just feel normal. You go, they check your BP, and then they see that is high. No symptom. And that high blood pressure can still affect many organs of your body. Remember, I say is the pressure going to supply blood to other organs. So it means when the pressure is too high, it can affect other organs. Many things can happen in their way going. The vessel can burst, all those things. So it might happen without you knowing, because usually the blood pressure can be without symptom, the high blood pressure. Obviously, there's certain people, they can have some funny symptom that they won't understand. You might have a light headache. You just feel a light headache that you cannot describe properly. You can have that blurry vision. You cannot see properly. You can feel dizzy. You can feel weak. You can feel your hand, one side of your hand or your arm is heavy, or your leg, one side is becoming heavy. But remember, as I said, the blood pressure sometimes is without symptom. So when you start manifesting those symptoms, it might be already complication. It might be signs of complication. So that's why we make sure that we control the blood pressure whenever the patient comes to hospital. So what caused the blood pressure? The blood pressure, we found two types of blood pressure, as we're talking about the diabetic one. But in the blood pressure, we do have essential blood pressure and secondary blood pressure. The essential blood pressure is the blood pressure which is somewhere and somehow genetic. It means your parent had blood pressure and it's going through the family. It's something like inheritance. You find yourself having the blood pressure. And there is one we call secondary blood pressure, which is related to many circumstances. It might be related to unhealthy way of lifestyle of living, an unhealthy lifestyle habit, or it can be also related also to your constitution. Remember those people who are very tall, very huge. You know, when the heart is doing that exercise of pumping, tunta, pumping, releasing. So if you are very tall, it takes time for the blood to go all over your body to come back. So it means the heart will work more hard than a person with a normal size. So the heart can get more tired. It's one of the cause also of imbalance on your on your blood pressure. You can also have low blood pressure. It means your heart is not pumping very well. But here we are here to talk about high blood pressure. So the secondary one, as I say, unhealthy lifestyle habit is like when you are smoking, it can affect your blood pressure. You are drinking too much alcohol. When you are overweight, you are obese, it can also affect your blood pressure. Blood pressure is a silent killer. Why do we call it silent killer? Because usually there is no symptom. And if there is no symptom, remember, it's still doing affecting your heart, affecting the many organs of your body. So you'll be surprised that the complication is there already. So what are the complications? The complication, the first one, I will start by the heart itself. When the heart is contracting, is a pump, is contracting, resting, contracting, resting. When it's doing it at elevated level, it gets tired. And that's why you see, we talk about the people with high blood pressure, with heart failure. We talk about the people with big hearts. You go to the doctor will tell you that your heart is big, your heart is getting weak. And the other complication, we can start by the head, as was saying my colleague. You have the brain. When the blood pressure is too high, it's going fast. It can make your brain even to be to drawn in the blood. You can have one of the vessels can burst. You know, when there is too much pressure in the pipe, you know what can happen to the pipe. It can burst. So it bursts, and then you find out that you develop stroke. So there is also some complication you find in your eyes when we talk about blurry vision. Yeah, what cause of the blood pressure to be low than normal? Okay, I'll answer that question. Let me finish with the complication. As I was saying, you can have the retinopathy. It means it's affecting your eye, your eyes, because when the BP is too high, you can have some small vessels. Those one are going to supply blood in the eyes. They are very small. It can burst. You won't feel, it won't affect the whole body, but you see, you start having blurry vision because of that elevated blood pressure. And you can have also, as I say, stroke can affect your one of the part of your body, the left hand, and the leg can get heavy, cannot function anymore because of that. It can affect also your kidney, not receiving enough blood. Without blood, nothing can work. Blood is like fuel in the body. So if your kidney does not receive enough, it's affecting also. If your so the complication is affecting the whole body, all the organs of the body. So we were talking about high blood pressure. I saw a question about low blood pressure. What can make someone to have low blood pressure? Remember, low blood pressure is uncommon. Sometimes it's not happen more often, but there is always, it can happen, but usually there is an underlying cause which can provoke it. The same cause also which can affect you to have high blood pressure is the same cause can affect you to have low blood pressure. In case of low blood pressure, we advise you to eat some, usually we advise you to eat salt, and we dig on doing some blood tests to find out what is making you to have the low blood pressure. It can be a disease that you have that you cannot see. So let me conclude by giving the therapy. The first therapy is your lifestyle modification. It means, first of all, you, except for those one has essential blood pressure, even them, they can control their blood pressure, making it normal by respecting the advice that the doctor is giving them and the dietitian. You have to control your weight. A normal weight. You don't need to be obese or overweight, try to lose.
I think we might let us just be patient. We know the issue of load shedding in South Africa.
Yes.
Yes, we're
Yes,
getting you. Your
yes, because
bandwidth is lower.
the load shedding comes, so I was trying to reconnect myself with the mobile data. Yes. So as I was saying, the therapy is, first of all, your lifestyle modification. Control yourself, the exercise, as my colleagues say, exercise more often, at least 3 to 5 times a day, 30 to 1 minute. Usually, sometime when you talk about exercise, the patient answer you, Doc, where I'm working, I'm very busy. So I'm always up and down. Remember, you are under pressure. You are working under pressure. It's different. It's even that one can cause even you to have blood pressure. But when they say exercise, it means you are in a condition where there's no pressure. You are exercising your body. You understand? So no matter how pressure is your job, when you have time to relax and exercise without pressure. And the secondly, control your diet. Don't eat too much salt. Don't eat too much fast food. Especially don't add salt on your food. Better you cook with salt, light salt, than to add salt after cooking. Usually, many makes that mistake. You see, when they buy their chips, they pour salt on it. When they eat, oh no, it's not enough salt, they add again. It might be very dangerous for you. So you exercise, your diet, control what you eat, and you lose weight. So if it's not working, all these things, we go through medication. And medication, usually we prefer to start with bead therapy. 2 kinds of medication. We can go up to 3, up to 4, depend on how we can control your blood pressure. If it's still not controlled, we reach even 4 therapy. Remember, we always try to find out if there is other complication related to it. We will check your kidney, we'll try to fix your thyroid, whatever can complicate it should be fixed so that your blood pressure can be stable. The other question can come, are you be able to be cured? Is it possible to be cured with blood pressure? I might say yes and no. Why I say yes? Because once your blood pressure is controlled, we consider that you are stable, so it's like you are cured. Why I say no? Because usually the patient, when they stop taking their medication, they say, no, I'm well, no, I don't need to take it anymore. And they found out after a long time, it comes back, it hits them. And when it hits them, it's very dangerous. It can go just high suddenly, and then you get stroke. So better you deal with this therapy with your doctor. If usually you take your medication after a long period of time, years you are taking medication, whenever you go for checkup to your doctor can see the level of your blood pressure. If he sees that your blood pressure is going low and low, he can start decreasing your medication, the dose of your medication, removing one, removing another one, until it's controlled. If he sees that he removes all the medication and now he lets you on diet, but remember, even though the doctor says stop all the medication, just take your diet, always respect your appointment with the doctor so that you will not be surprised with a peak, sudden high blood pressure, which can kill. Thank you.
Wow. Thank you very much for all those information. I don't know if anyone has a question. Anyone has a question? Any other question? Is there any other question? I know we are hit by the load shedding. We are already in the dark here. One thing that I wanted to understand now, what is the relationship between salt and the high blood pressure? Because now you're saying we shouldn't eat with so much salt. What does salt has to do with the pumping?
Okay, salt is one of the substances which can influence your BP to go high in your body. It's one of the substance when it come in your blood, it increase what can I say? It increase the fluid of your blood, so that the BP, the heart also cannot pump it. It's getting, I want to say it in the simple way, like it's getting heavy. Your blood is not fluid the way it's supposed to be. You see,
Ah,
so
okay.
affecting your blood as a substance. It's one of the
Oh.
substance in the blood. Mm.
Okay. Okay. And also you talk about being overweight. I'm just wondering if you can just break it down. How being overweight or obese affect the way my blood has to be
Yeah,
pumped?
remember when you gain too much weight, the heart is doing the main job by pumping, relaxing, and pumping, relaxing. The more you are getting weight, the more the fatness in your body is getting around your blood, around your heart, is compressing also your heart. And when your heart is getting more compressed, it cannot easily work the way it's supposed to be. So the work of your heart, it's becoming disturbed. So even the pumping is disturbed, it can complicate your blood pressure. And in the other way, also when you are getting too much weight, bring fat. And those fats, it's always make complication in your blood, in the vessels. It can compress the vessels. The vessels cannot push nicely. Remember, like a pipe. Water is coming, going through the pipe. Just take that pipe, squeeze it in a hole. I think the pipe will not work properly. The pressure will not circulate properly. So it's all about the heart will try to pump more, to push more, and the pressure from the hole pressing the pipe, so the circulation will not be enough.
Oh, okay. Okay, no, thank you for that clarification. I'm just putting this question to you and Dr. Mia. You talk about remedy in terms of taking medication. And we all know that sometimes medication harm us. You see, it's happened that the more you take medication, you end up even creating more problem. Is there alternative way? I know you talk about lifestyle, you talk about diet, but do we have to go through the medication?
Okay, as I said, before we reach even medication, we started with the lifestyle. Okay, I think I see where you are going with me. You want to see if we can replace the medication with the herbs, because usually is what happened. They ask if we can replace the medication with the herbs. Yes, you can take it, even though I don't have experience on it. It can still work, but remember, you don't know the dosage, you don't know how you take it. So if you cannot control it with your physical exercise, your diet and everything. You just say, let me eat whatever I eat because I can take moringa, I can take this, it's working nicely. But remember, this thing we are taking without knowing the dose, it can still affect. You understand? It can still affect unless you reassure yourself that your lifestyle modification follow the principle. If you follow the principle, you add on the herbs that our mother, the remedy of the grandmother, I think is not bad. But still, you need to go for your checkup so that we know. Remember, it's a silent killer. We don't know what it can be, it can do in your body. Even though you choose to go for the remedy, still attend your monthly consultation or trimestral consultation so that we know what happened in the body. So does moringa really help to lower the blood pressure? Okay, moringa, as I can say, in the scientific way, I cannot tell you yes. By true experience, we saw the patients that we know, they took moringa still coming to consult. Then we saw their blood pressure was stable. So we encourage them, as long as every 6 months they come, we do the checkup, we check the heart function, we check the kidney function, the liver function, the thyroid function, everything is working well, we're still happy. But if like it's not working well anymore, I will advise him on top of your moringa, add whatever I can present to you. So I cannot tell you 100% it's help, but it's one of the remedies that we saw patients, it's working on them.
No, thank you very much, Dr. Annie, for that great that great presentation. And Dr. Mia, we really appreciate you, your presence here. We just going to end by saying we all got from them that is serious. And Dr. Aniki Ponce is a silent killer. And we need to really have ourselves check up regularly, because when it comes to high blood pressure, it doesn't show up. It's only through the checkup that you can actually detect that you are suffering from that. So it's very important. And again, once you have been diagnosed with those two conditions, there is need for you to really take care of yourself. And taking care of yourself, both of them underline the lifestyle change, exercise, the food, and also for some people, extreme case, you have to go through medication. If I'm not mistaken, you have to go through medication that will really help you in controlling. And once it's stabilized, yes, once it's stabilized, you can now just live your normal life. But there's a lot of work, and that has to be done. And they say that goes that prevention is better than cure was highlighted by our wellness coach, Gil, who say we only have one body. Let us take care of that body. And if we don't take care, we've been hit by this type of diseases. And it's not even the disease that kill, as they highlight, is the complication. The complications are very dangerous. And they goes, and when they hit you, it's from the head to your toe. So it affects your body to the point where you can, the fatal end can hit you death. So it's very serious. And nowadays it become very prominent. We see it out there with the type of lifestyle that we are being exposed to. Gil also talk about the industry, the food industry that is even prompting us to only consume things that is going to help us. So we have to be very mindful. On that, I would say thank you very much for making your time. For all those who join us tonight, we really appreciate your presence here. And join us again in 2 weeks' time. We're going to look again at other topics that are dear to our heart, that matter to us. Let us talk about it. And for those of you who are struggling with weight, with obesity, we do have a program, a weight loss program. Please connect to our page. It's starting 1st of March. It's a 1-month program, intensive program in how to control your weight through exercise, change of lifestyle, coaching. We really work the journey with you because we know that how important it is to look after your weight. So on that, I will say goodbye and stay connected. And if you are not yet connected to our page, it's Coach Diva Josie on Facebook. Please connect, share for more content. And yes, we are here to serve you. And we have other coaches around that are available to help when it comes to marital matter, wellness matter, and business matter. I will say thank you very much for joining and stay tuned. I don't know, just as we are closing, thank you very much, Dr. Annie. If there's any words you would like to put forward, also Dr. Mia, but as for me, I would say stay blessed and bye-bye.
No, I think I'm done. Eh?
Okay.
I can't even follow you anymore. I don't know where to find you, but I think I'm done.
Okay. So
Okay.
see you next time, and see you next time. Yes.